Hi, Assalamualaikum everyone. My name is Nurhaiza binti Zakaria and my metric number 261370.
My name is Rohaiza binti Zakaria. My metric number is 161719.
Hi, my name is Nur Atirah binti Abdul Rahman. My metric number is 262276.
My name is Nur Hidayat binti Muhammad Muhtar. Metric number is 262654.
Organizational development is an objective-based approach used to start a planned change in a system of an entity either on a short or long-term period. It is usually conducted by an external change agent or senior management known as internal change agent who serve as trainers, mentors and teachers. The main goal of organizational development is to improve the entire organization, including individuals, department, work group and society as a whole. The public organisation that we had choose in this assignment is Seberang Jaya Hospital in Pulau Pinang. Seberang Jaya Hospital is one of the main hospital in Penang. It was completed in February 1995 and begins their operations on 1st April 1995. Seberang Jaya Hospital vision is providing optimum service in a caring manner, while their mission is first to provide efficient, effective and quality diagnostic, curative, rehabilitative, preventive and health promotion service. Second is with emphasis on caring, professionalism and teamwork, and their third mission is respecting patients' rights. The reason why we choose a healthcare organization is because we are aware that the health organization is one of the most important organization in Malaysia. Therefore, we want to know about the organization and also their members' performance and development and how much did OD influence on them, as well as we would like to anticipate and propose change needed by them. Okay, now let's move to the second major phase in the approach of plan change, which is the diagnosis process. In the diagnosis process, we are using the organizational level model approach. This model consists of three phases, which is input, design component, and output. In the first phase of the diagnosis, which is the input phase, we had done the in-depth analysis towards the general environment and the industry structure of Seberang Jaya Hospital. Their organization's affairs are mostly influenced by the general environment. First is government policies, where as a public organization, all the policies formulated by the government must be executed by them as government agency. Second is demographic factors such as socio-economic factor. Usually, individuals who seek for treatment in their hospital are usually the less fortunate one, middle income class or in the B40 group, because they do not have pay too much money to get treatment compared to the private hospitals. Third is medical technological development that transforming government healthcare providers to have a better treatment accessibility. Now we are on the second phase of the diagnosis, which is the diagnosis on the design component. First, the diagnosis have been done on their human resource system. Seberang Jaya Hospital is using a functional organisation structure. As a public servant, the government are responsible for managing their salaries, salary increment and benefits for them. Mostly, the employee were clear about their organization's goal, and for the strategies to achieve those goals, she said that they are always collaborating with each other in an effort to provide excellent service to all of their customers. And then, their organization also had provide a stress management programs and counseling in order to ensure a better productivity of the employees. Next, we get to conduct a diagnosis on their working structure and technologies. most of their administrative processes that take place in their organisation is based on the Surat Perkeliling Perkhidmatan. As for the reward mechanism, any of the employees who successfully fulfill the conditions set by the Perkeliling Kemajuan Pentadbiran Awam will be awarded with Anugerah Perkhidmatan Cemerlang known as APC, and also they get to be awarded by job promotion. The division of labour in Hospital Seberang Jaya are done based on their qualification, position and grades. This way of division are very effective in their organisation because it can avoid duplication and mixing of tasks where every organisation can focus on their job and duty only. Job rotation procedures have been made in the organisation, but it is not running effectively because when the employee are learning new things at work, sometimes they tend to make some mistake and error. Same goes to task coordination that had been done, but it is also not effective as the workload are not distributed fairly among them. The updated technologies in their organisation did make working affairs become more smoothly. For example, the modern office technologies and the upgraded medical technologies make their procedures more smoothly and increase the patient belief on their procedures. Next, we move to the organizational diagnosis on their organizational culture. They are using performance-based work culture by using Key Performance Indicator or KPI to improve the quality of service delivery. According to the interviewee, their organization are experiencing some unhealthy working culture, especially involving the medical officers, where stress from work, unconstructive or productive work culture, excessive working hours are the main causes to mental stress. Also, there is a gap of duty between specialists, medical officers and houseman officers, which all of them supposed to be working as a team. The input and design component diagnosis that we had done had led to the last phase of the organizational level diagnosis, which is to understand on the organization's output, specifically towards the organization's effectiveness. In terms of work performance and productivity of the employees in Seberang Jaya Hospital, the interviewee said that the employees are having a quite good work performance and their productivity is also satisfying. However, there is also some factors that somehow decrease their productivity on work, such as the ineffective job rotation and task coordination, and for some employees, the unhealthy working culture had decreased their work performance.
Seberang Jaya Pulau Pinang Hospital is the one of the government organisation in Malaysia. However, the organisation also has problems that employees has to face. This problem arises because an organisation does not run smoothly and does not resolve problems that arise properly. Among the problems that often arise in the organisation of Seberang Jaya Pulau Pinang Hospital is having to deal with the problem unbalanced division of work. The problem faced by Seberang Jaya Pulau Pinang Hospital is the unbalanced division of work. This will cause injustice in the performance of duties for the workers. The effect is that some employees have to deal with doing a job at a time, while some of other employees only have to do light tasks. For example, there are nurses who have to do a lot of work at one time to monitor and also examine this patient is a task that many need to carry out. However, in contrast to some nurses who are only assigned to the service counter, nurses who take care of the counter division do not have to waste time to do this monitoring as their job is to take care of the counter at the front only. The second problem faced by workers at Seberang Jaya Pulau Pinang Hospital is burnout. This burnout problem that happens when employees are stressed and are unable to interact with people they are connected and their environment. However, this problem can be seen increasingly during the COVID-19 pandemic, which hit the whole country, causing some doctors and staff of Seberang Jaya Pulau Pinang Hospital to be stressed. Lastly, according to Nurul Hafiza binti Muhammad Rozi, the problem faced by the organization of Seberang Jaya Pulau Pinang Hospital is the quality of service problem. Seberang Jaya Pulau Pinang Hospital is faced with ethical problems while carrying out its duty. The employees at the hospital sometimes disregard the worker ethic, which result in the poor quality of service at the hospital. For example, employees at the inquiry counter are slow to provide feedback to patients or customers who come to get service.
There are some of intervention recommendation based on the issue problem arising in Penang Seberang Jaya Hospital. First of all, the organization can make an intervention by do a reshuffle and job rotation consistently to handle the problem of unequal division of tasks. The hospital manager can set job rotation policy consistently for each available unit, whether it is health unit or finance unit. Job rotation is planned on the job training for the cultivating future candidates of management by transferring a management trainer from one department to another to increase his or her understanding and credential in all aspects. This job reshuffle and rotation can be done once every 5 years in order to increase the experience with new knowledge and information as a learning process. As a result, when most of doctor and nurse have a knowledge in various areas in the hospital, they can help other employees who have a heavy workloads while being able to balance tasks in the hospital. Second, redesigning on-call work scheduling amongst health workers. This hospital need to do some intervention by redesigning on-call scheduling amongst health workers. The works on-call is used for overtime work for doctor. On weekday, Monday to Friday, on-call start from 5 p.m. to 8 a.m. the next day, which is for 50 hours. This means the doctor works for 24 hours during that period. Even worse when the doctor has to resume work at 8 a.m. after finishing all on-call until 5 p.m. This makes the doctor feeling tired because they need to continue working until time reach 33 hours non-stop. In this case, hospital management of Seberang Jaya can redesigning on-call scheduling to reduce their burdens and each member is given a fair day off. They need to make sure to rotate responsibility and distribute work as evenly as possible. For example, the practice of flexible schedule should be practiced by Seberang Jaya Hospital by allowing those who work on call to be outside hospital ground. However, there are several factors to consider, which is size and distribution of the teams, employee capabilities, team location, and discretion of the department's head. Hospital can also schedule by providing long breaks while on call by providing restroom. It is intended to provide adequate rest to health workers during on-call to prevent them from experiencing burnout. 3. Hold online seminar or courses for service improvement. To ensure the concept of effective quality service in Seberang Jaya Hospital, hospital management need to carry out intervention by trying to improve the quality of customer service through whole online seminar or courses for service improvement. For example, seminar on work ethic and professionalism can be conducted during holidays to increase a high level of ethics and professionalism in carrying out work, especially when communicating with patients. Through the knowledge gain, it is indirectly able to improve the quality of a service of employees in Seberang Jaya. In describing the proposed intervention based on the problem faced by Seberang Jaya Hospital, there are several benefits as a result of the proposed intervention mentioned before this. First of all, if a hospital management made a reshuffle and job rotation consistently, they can help employees gain a knowledge and develop their skill. The definition of job rotation here refers to a professional job cross-training plan that help employees expand their job territory while broadening their working experience and skill, stimulating their working spirits and cultivating the interpersonal relationship by shifting medical personnel to different departments or units of the same department. Job rotation inspires nurse and doctor in Seberang Jaya Hospital to achieve a higher performance, allowing continuous growth of work, extended knowledge and skill, and increasing hospital patient caretaking quality. For example, nurse or doctor who are working under the medical management department can make a job rotation by working under the Women's and Children's Service Department or the Clinical Diagnostics Department. Second, the benefit of redesigning on-call work scheduling among health workers can help organizations to make sure the employee able to work more efficiently. Hospital management need to redesign on-call work scheduling to make sure all the staff get enough rest and make a hospital retain valuable staff and increasing employee productivity. As we know, the recommended number of hours of sleep for adults is 7 to 8 hours per night. Therefore, adequate sleep is important to ensure healthy brain function, able to think normally, able to analyze data well, and able to remember things better. Hospital also can providing a restroom to give an opportunity to health workers who have just finished their work before they want to resume on-call schedule. For example, the staff will have an adequate rest, can work well for the next day, make a good decision in every discussion, and able to treat patients in a cheerful manner. It shows that when our body is healthy, then we can work effectively and efficiently. Third, by do an intervention through online seminar or courses can improving ethics and integrity amongst employees. The knowledge shared can remind and make staff aware that work ethics is very important while performing duties. Therefore, through the knowledge learned, they can implement it into their works. The nature of trust, transparency, responsibility and serving the public interest is the essence of the terms integrity and ethics. Organizations that practice ethics and integrity will be highly regarded of society. For example, medical officers who provide the best service to the community, such as improving service over the phone, making appointment accurately, and good treatment of patients, and at the same time, the good names of the organization can be maintained. Therefore, the practice and understanding of integrity and ethics must be implemented by organizations through the seminar or courses.
Obstacles to organization change. First, this fits with the purpose reshuffle works and job relation. Work reshuffle will usually be done once every 5 years to improve the quality of employees in the organization. However, this work reshuffle become hindrances to the organization has not the all employees agree with the proposal. This is said to be so because some the employer has felt comfortable with the current work position. However, it's become difficult to be implemented by the department heads. For example, employers who have workers under the medical record unit are interested to switch to human resource unit after reshuffle is done. This is so causing inspire depreciation because they are too comfortable doing the previous job compared to the new job with recruitment them to start from the bottom to new learn team. Next, the second obstacle is the lack of staff to work to accommodate the number of patients available. Lack of staff make work stress on users. Nurses at the Seberang Jaya Hospital in Penang have to work overtime, especially during the COVID-19 pandemic. For example, the lack of staff caused a nurse to have to care for sick patients at the same time because the number of patients is increased day by day. Therefore, the Seberang Jaya Hospital in Penang could not come over the obstacles difficulty is very difficult time, and they are very difficult to get a new civil servant in a short time. There is also the withdrawal of nurse to other hospitals. The third obstacle is the time constraints for conducting seminar. Seminar are an important thing in every organization to create employer to be more productive. However, this effort has impact due to time constraints to nurse and doctor. This is because they have to work overtime to make sure patients get good treatment. Very difficult time constraints are also disadvantages for department has to conduct seminar one amount of their employer. For example, a doctor who is on call need to go to the hospital as early as 7 a.m. to work and stay wake up at night until the time morning and return to work until the evening. They increase in the number of patients caused by COVID-19 virus interaction at the Seberang Jaya Hospital in Penang has caused time constraints in the job as a doctor with no time to be the below family.
In conclusion, that change that takes place in an organization requires the role of various parties. This is said to be so because with the cooperation of various parties, every problem that occurs in an organization can be overcome and can help the organization achieve its goal quickly.